Hey everybody, this is Dr. Vince from FTR in Joliet. Thanks for watching. Today we're going to cover the exercise VORx2 while walking. Okay, now this exercise can be very useful for retraining the vestibular system, especially if you feel like you lose your balance when you turn your head to look at something. This exercise should only be done under the supervision of a physical therapist or a physician, because you're adding movement in with head motion, which can increase your risk of falling, and that's not something we want. So again, if you're having a vestibular problem or a dizziness or balance problem, call your physical therapist. If you're in the Joliet area, look us up at FTR. The exercise looks like this. You're going to hold the card in front of you. You're going to turn your head and card in opposite directions. If you don't understand how to do the exercise, go back and look at the exercise called VORx2 seated. When you've progressed past seated, past standing, you are now ready to walk. So we're going to do VORx2 with walking. Your eyes should remain focused on the object that you're trying to remain stable with, which on the card is the logo that we talked about before. If at any point the card becomes blurry, you start deviating. This is a common thing that we see with this exercise, is when patients start doing, well, first problem we see is patients have trouble just coordinating the motion, right? And so they have trouble moving the card and head in opposite directions while keeping their eyes going on the object they're trying to focus on. What we'll tend to see is patients completely lose it and just start doing this. This does not retrain your vestibular system. That exercise is not useful for most patients. There are some patients that we will do that with, but not most. So again, you'll start off by going opposite directions. The other error that we tend to see is when patients start walking, we start getting that, which is why you should be doing this in the presence of a physical therapist or under the supervision of a physician. Because the second you start crossing feet, you increase your risk of falling, and that's the last thing that we want to happen. Again, if you are having dizziness or balance issues, call your physical therapist. You can find us at FTR in Joliet. Thanks for watching.